Good afternoon, Dr. Lindsay. My name is student Dr. Tosca Neidl, and I'd like to give you the case presentation of our new patient, Ms. Corey Roberts. Ms. Roberts is a 45-year-old Caucasian female who came to our clinic today looking to establish new patient care while also looking to receive her annual flu vaccine. Ms. Roberts just moved to the area with her husband and 2 children, and she also is employed as a local high school math teacher. With respect to Ms. Roberts' medical history, Ms. Roberts has hypertension, for which she takes lisinopril 10 milligrams once a day, and she's been doing so for several years. Ms. Roberts denied any other major medical diagnoses and denied any other medication use, just the lisinopril once a day. And as per concern of her, she was looking to refill her lisinopril because she's in between insurance plans and doesn't have any currently. And I informed her that at our office we do not give refills, but I was glad to set her up with low cost and affordable options with local pharmacies so she could receive her lisinopril in the meantime while she's waiting for her insurance to kick in. Other pertinent notes of her medical history is for surgeries. She had a previous tonsillectomy, but she denied any other hospitalizations or surgeries, and she did claim, or she did state to have an allergy with sulfa drugs, which produced a red rash. For family history, her father has, or she told me, Ms. Roberts had informed me that her father has been battling thyroid cancer, and he is in his 70s, and her mother, who is in her late 60s, has hypertension. But she denied any health problems within her 2 children. As per the visit, she had the initial screening that she had done before I was able to interview her in the room was a little high. Her initial blood pressure was read as high as, I believe, 144/95, which was pretty concerning. But when I got in the room, I reassessed her blood pressure with her permission, and it was down to a more normal, 121/79. So we chalked it up to just maybe the nerves, maybe not sure what else would have caused that, but she herself, she seemed more relaxed, and as I said, upon rechecking was normal, and also her heart rate upon rechecking was at 61 beats per minute, so back within that normal range. So she got relaxed, and we were able to do that. Also, with respect to the physical exam I conducted a quick spinal sweep with her permission from the back of her shoulders down to her lower back. I did not find or note any acute or chronic tissue texture changes upon that exam. And following that, we went over her flu vaccine. We discussed any contradictions. She said that it had been over 1 year since her last vaccination, and she had never had a previous reaction to a flu vaccine, nor did she have a previous allergy to eggs. And upon inspecting her arm, she had no bruising, bleeding, or soreness. So we went ahead and conducted that procedure, and I administered the flu vaccine in her left deltoid. Following that, I gave her her information sheet. I informed her that she had any questions, she should be happy, or she could be happy to, or we would be happy for her to review that sheet, and that we would have her wait there 15 minutes just in case any reaction would occur. And following that, we did a quick consult. We ran through what our next steps are. I informed her that at this time that I didn't see it necessary to have her change her medication, and that we would like to see her back in a month to see how her blood pressure is doing. And then we would see if there was any need to lower her blood pressure, or increase her blood pressure medications. I found no indications for OMM treatment at this time, given the negative spinal sweep. No tissue texture changes were noted. And I also informed her, asked her for her consent to, if she would have us do some basic labs with her, CMP, CBC, as well as a urine analysis, as she's a new patient, so we can establish her baseline. She said yes to that. And finally, I informed her that we'd like to see her back in a month, and that I didn't see it necessary for any referrals. And I did counsel her on her activity level. She did mention how she only exercises moderately twice a week, and I did say, despite her otherwise being healthy, that maybe that would be a point of improvement, But other than that, I thought she was happy and healthy. Thank you again, Dr. Lindsay, and I hope you have a good day.